Welcome to The Verdict. Kent Meyers and Mick Cornett joining you again this Sunday morning. We, Mick, today are going to have Dr. David Blatt from the University of Oklahoma to join us to talk about all that he's doing and a lot of other topics. He's been on once before and was such a terrific guest. We asked him to come back again. How have you been, by the way, Mick?
I've been good. I'm looking forward to hearing from David today. There aren't very many people that can broadly talk with confidence about so many different subjects, and he's a good thought leader, and the state's lucky to have him.
Yes, indeed. And we're lucky to have him today, and I know our viewers are going to enjoy it. So, folks, stick with us. We're going to take a commercial break, and then we'll be back with Dr. David Blatt. You're watching The Verdict.
I've always been a public servant. I've served either tribes, I've served the federal government, or I've served state governments. The law allows me to express my natural desire to advocate. My name is Stephanie Cochran. I am an attorney, and I am Chickasaw. Lawyers give their clients, and in my case, tribal governments, a voice. And it's through legal decisions that tribes have been able to accomplish and to regain some much lost footing that they encountered in the late 1800s and the 1900s. When I reflect back on this time in history, I think I'll look at it in terms of opportunity. And I think now we have to turn those opportunities into long-term success for our future generations.
See more stories about the Chickasaw people at profilesofanation.com.
One of the best kept secrets about the post-9/11 GI Bill benefit is that it can be used at a trade school or a technical school, and it doesn't have to be used at a university or college. These are benefits that the veterans have earned through their service, and they should take advantage of it.
Veterans really need to understand that there are many resources offered by the Oklahoma Department of Veteran Affairs. They are there to help you find the right school for you, the school that will help you and your family make great steps into your future.
Welcome back to The Verdict. Kent Meyers and Mick Cornett, and our guest, Dr. David Blatt from the University of Oklahoma Tulsa. David did his undergraduate work in Canada, did his master's work in Canada, and got his Ph.D. at Cornell. At Cornell, he met his wife, and thankfully we have been able to, who got a job at Oklahoma State University, brought him to Oklahoma, and we've had him captured here pretty much since then. David did 10 years as executive director of the Oklahoma Policy Institute, a nonpartisan think tank in Tulsa. In January of 2020, he joined the University of Oklahoma Tulsa faculty, teaching in the MPA program, which we're going to talk about a little more in the future. He has won many awards, both in the political science and in the social worker area. He was National Citizen of the Year from the National Association of Social Workers. David, it's sure good to see you again, and welcome back.
You too. Thank you so much for the invitation.
David, I know so much of your work from the Oklahoma Policy Institute. How does this new role compare? What would you say are the commonalities and the differences?
Well, I'm certainly building on the work I did at OK Policy. There, we were a state policy think tank that looked at policy issues and did research, analysis, and advocacy around expanding economic opportunity and well-being for Oklahoma citizens. And in that role, I worked extensively on a broad range of mostly state policy issues. So worked on the budget and healthcare and poverty, education, criminal justice, and so on. As I've transitioned to position in academia, teaching public policy, I've really been able to tap into a lot of the policy issues that I worked on at OK Policy, and also a lot of the connections that I made over a couple of decades, working first at the legislature as a member of the Senate staff, and then as public policy director for a nonprofit anti-poverty agency in Tulsa, and then at OK Policy. So it certainly is different work. Running a nonprofit organization involves a lot of fundraising work, hiring and staff relations. Don't have to deal with any of those issues. I've really been able to dig in and look at things like economic inequality and education policy and healthcare policy, build on the work I did at OK Policy, but dig more deeply and also look at it more from a national perspective.
What is the MPA program designed to do?
Well, it is a part-time program. All the students in the program take classes in the evenings, and then there are a lot of weekend and summer classes. So it's really designed for somebody who may be going to work to 4, 9 to 5, and then is taking classes. We have 2 concentrations. One is in nonprofit management, the other is in public policy. So most of the students in our program either come from the nonprofit sector, from state and local government, maybe work in law enforcement or public safety jobs, and really trying to give them the tools to be more knowledgeable and more successful in their chosen fields, which tends to be nonprofit and local government.
David, I can remember you kind of opening a lot of people's eyes to a lot of really big picture issues, coming at issues on an intellectual side. When you first started compared to now, how different are the issues? Do you find that we're still suffering from the same issues that we were facing when you started, or have we moved in one direction or the other?
You know, I've been doing this for about 20 years, so I would say there's a lot of ebb and flow, but that it tends to be more maybe circular and recurring. I don't think we've solved any of our problems. I remember pretty soon after starting the work of doing public policy in Oklahoma, confronting our budget shortfalls and need for new revenue, and coming across the idea of a structural budget deficit, where year upon year revenues fall short of meeting the cost of funding public services, which creates the question of, you know, are there ways to raise new revenues or restructure the tax code or deliver public services differently to try to bridge that gap? And I would say, you know, over 10, 20 years, we've seen more acute budget shortfalls. We've seen full-fledged crises. We've seen better periods. But fundamentally, we're still grappling with this issue of chronic budget shortfalls. I've been working on healthcare policy for 20 years, and some of the same questions that I was facing in the first years of the 21st century are the same ones we're facing right now. How do we pay for healthcare? How do we ensure that everyone has access, timely access to quality care? How do we ensure that all Oklahoma students get a quality education? How do we make our criminal justice system more efficient? I think a lot of these issues, we come up with different solutions, maybe make some progress. I don't think we've really solved anything once and for all.
Talk a little bit more about the healthcare area. What is your view about the importance of Medicaid expansion in Oklahoma?
I think that's going to be a major shift. So the voters approved State Question 802 in June by a very narrow margin by 1%, but still that is going to go forward. It was a constitutional amendment, so it really was designed to include the legislature from coming in and overturning the people's vote or tinkering too much with it. So we know that beginning July 2021, that we will have expansion. What does that mean? Well, right now we have a Medicaid program that serves roughly 800,000 Oklahomans, primarily low-income children, seniors, those with disabilities, and a very narrow category of working-age adults. Really only the very, very poorest, if they're parents of dependent children. With expansion, now if you are working age 18 to 64, and your income falls below the federal poverty level, which is about $20,000 for a family of 4, then you'll be eligible to have coverage. And we know that that population tends to have the highest rates of uninsured and the highest rates of chronically poor health. So having access to Medicaid, we've seen this in all kinds of other states. It gives people more regular access to health care and can make a real difference in meaning that when they have healthcare needs, they're able to see a doctor, fill a prescription, deal with recurring mental health or substance abuse issues. So the best estimates are that some 200,000 Oklahomans will be able to get coverage through the Medicaid program beginning in July of 2021, and that should make a pretty significant dent in the number of uninsured. We're also seeing, as a result of the pandemic, is an increase in those without health insurance over the last several months, particularly as people have lost their jobs. Many of those who have insurance through their employers are now finding themselves in the ranks of the uninsured.
David, when you look at healthcare and from a rural perspective, it appears to me that there's a significant difference in the way that rural Oklahomans view healthcare and the way that urban Oklahomans view healthcare. How do you resolve that, and how do you feel about it after studying it?
Well, let me be rude and interrupt.
Okay.
But our sponsors require it. David, keep that question. But we're going to have to take a 2-minute break here, and we'll come back and hear what your answer is. You're watching The Verdict with Mick Cornett and Dr. David Blatt.
OU Law has a history and heritage that are unparalleled. At the University of Oklahoma College of Law, we empower our students to pursue the career of their dreams. We have the highest U.S. News ranking ever achieved by an Oklahoma law school. We are the first law school in the country to launch a college-wide digital initiative. And this year, our competition teams rank #2 in the nation. OU Law, generations of excellence, limitless possibilities.
The good life comes naturally to Tulsa, where nature's beauty is matched with an eye for aesthetics. A legacy of neighborhoods graced with lawns and landscaping and handsome homes. A place that seems to have patented an ideal lifestyle. Bank First is loyal to the quality of life Tulsa assures its citizens, to the priority placed on education, culture, and growth. Loyal to builders who transform raw land into residential charm. Developers who see opportunity and add vitality to Tulsa's economy. Bank First serves both enterprise and private lives that need a loyal partner. It's how we help nurture this city's very good life. Bank First. Loyal to Oklahoma. Loyal to you.
Welcome back to The Verdict. Kent Meyers and Mick Cornett with Dr. David Blatt. I rudely interrupted Mick's question and David's answer, so let's go back there. Mick, you want to rephrase?
Yeah, urban versus rural healthcare, delivery, perceptions. What are your thoughts, David?
Yeah, we definitely have seen a real crisis in rural healthcare in Oklahoma. We have hospitals that have closed. We have and are struggling with significant financial losses. We have higher rates of uninsured in rural areas. And so Medicaid expansion is seen as a lifeline for a lot of these rural providers, knowing that a hospital or a clinic can really be a lifeline for rural community, that if you lose that fundamental institution, that it can really hasten the decline of a community. At the same time, we saw, if you looked at the vote on State Question 802, there were definitely some discrepancies from community to community, but for the most part, 802 did best in urban areas and did more poorly in rural areas. And I think that really is a reflection of deep partisanship that we see here, we've seen it again with most recent elections in those rural parts of the state that have become overwhelmingly Republican, that Medicaid expansion and the Affordable Care Act that led to the Medicaid expansion was seen as part of the Obama legacy, referred to as Obamacare. And I think a lot of voters who may have been supportive of the idea of expanding healthcare, giving more people coverage, were really skeptical about an initiative that was associated so closely with former President Obama.
Mm-hmm.
David, let me ask you a little different question. We've been talking about how Medicaid expansion came about by virtue of an initiative petition that is labeled by many, I think accurately, as direct democracy, where the people bring up issues and vote on them and decide whether they want them or not. Oklahoma has a long history, since statehood, as a matter of fact, of the right to employ direct democracy. What's your take on Oklahoma's utilization of that instrument?
I think it's inevitable that it's going to continue, Kent. As you said, there's a long tradition. Most states do have the right to initiate legislation through a citizen process. In Oklahoma, has seen multiple voter-led initiatives, particularly over the last election cycles. I think Medicaid expansion is an interesting example. There was substantial frustration among many people that we had this opportunity to expand health insurance coverage and provide care for some 200,000 Oklahomans. And the legislature, year after year, studied the issue, talked about it, but ultimately failed to get anything done. And, ultimately, a group of citizens with philanthropy, with Hospital Association and others said, if the legislature won't act, we'll do it ourselves. We've seen some criminal justice initiatives that have sort of a similar background with mixed results. Passage of State Question 780 several years ago, but now the failure of State Question 805. I think one issue that may be ripe for an initiative petition is the minimum wage. It's been stuck at $7, $7.25 since the late 2000s. The legislature won't even permit a bill to pass. What we've seen across the country, most recently in Florida, is that when you put a minimum wage expansion on the ballot or minimum wage increase, that tends to pass with overwhelming support, even in states that are very conservative, like Oklahoma. So we saw states like Arkansas and Nebraska, Florida most recently pass minimum wage increases, Missouri. So, that may be an issue where voters say if the legislature won't do anything about it because of the influence of groups like the state chamber, then let's see what the voters themselves will decide.
David, let's talk politics. What did you think of the November elections for the state of Oklahoma?
It was fascinating. I think if you just look at Oklahoma, what we've seen are trends in recent elections over several decades just intensify here. So, we have such a major shift between urban areas which are competitive and which have been trending Democratic. Democrats did lose a couple of seats in the Oklahoma City area that they had picked up in the 2018 off presidential year. But, for several election cycles in a row, we've seen the Democratic presence in the legislature shrink to the two metropolitan areas. And this time, the Democrats went into 2020 holding just 4 seats in rural Oklahoma and lost 3. So the only member outside the 2 metropolitan areas is now Representative Trish Ranson from Stillwater, which is hardly rural, but it's non-metro. Other than that, we see Republicans controlling every seat outside the metros with growing majorities. And, at the presidential level, you saw President Trump basically maintain his vote from 4 years ago. He won 65.4% 4 years ago, 65.3% this year, so essentially unchanged. Joe Biden did improve several percentage points over what Hillary Clinton won, but once again failed. The Democrats failed to win any county. However, projecting trends, I think what we're seeing, Oklahoma County, maybe ultimately Tulsa County, moving more towards the Democrats, while the rest of the state remains solidly Republican.
A lot of new voters.
And overall, compared to 2016, there was about a 7% increase in turnout, about 100,000 people. So not as much as many other states. And in fact, data that I've seen show that if you look at turnout as a percentage of the voting eligible population, Oklahoma was about 55%. That if you exclude those who are not even registered to vote and those who didn't vote, just over 1 in 2 in Oklahoma cast a vote. So we're actually last in the nation in the percentage of our voting eligible population that turned out this year in 2020. There was a increase compared to 4 years ago. And I think all in all that benefited Republicans, that we've seen all the registration increases of recent years has essentially all been on the Republican side of the ledger. Again, particularly in rural and what they call exurban areas, not in the cities or the closest suburbs, but as you go further out of the cities, that more rural small town vote really helped President Trump build up his margin and reinforce the supermajorities that the Republicans enjoy in the legislature.
David, I'm afraid that's going to have to be our last word for this show. It's been very interesting, and we didn't get near enough time to talk to you like we wanted to, but we hope you'll come back again soon. We have been visiting with Dr. David Blatt from the University of Oklahoma Tulsa. Mick and I will be back in just a minute. You're watching The Verdict.
It used to be okay in hospitals. It used to be okay in movie theaters. It was okay in classrooms, restaurants, and airplanes. But thanks to a greater understanding of the dangers, that's not okay anymore. So now that we know secondhand smoke causes lifelong health problems, why is it still okay to smoke with children in the car? Bottom line, it's not okay. Let's get serious about protecting kids. Join the fight at stopswithme.com.
All children deserve a life of hope and love, but sometimes they experience a life of pain, neglect, and abuse.
When that happens, each child deserves all the quality assistance and representation that can be offered in our legal system. For more information, call 23-CHILD.
Oklahoma Lawyers for Children, helping to bring hope and love back to the lives of abused children.
You will always be mom and dad to me.
I really think people are so unaware of the number of kids waiting just in Oklahoma. And I think if more people knew that those children were out there waiting, I think that just by the way we live our lives and the people we talk to, that maybe we can help encourage adoption from Oklahoma.
You will always be mom and dad to me.
The Journal-Record is pleased to be a sponsor of The Verdict. The Journal-Record, since 1903, the best source of Oklahoma business news and legal information.
Welcome back to The Verdict. Kent Meyers and Mick Cornett visiting with you today. We've been pleased to bring you Dr. David Blatt, who I think gave us a lot of good information. Mick, what are your thoughts?
Well, David's always a wealth of information and opinions. I love listening to him. And he's at OU Tulsa. You can find them on the web at ou.edu. And we have a website, theverdict.tv.
We'll be back next week with another interesting guest. Thanks for joining us today, and we'll see you in a week. You've been watching The Verdict. Thanks.